One thing I have been able to determine in all the research that I've done up to this point is that antibiotic usage for routine infections really is a disservice long-term for long-term health outcomes. That seems pretty clear. But you see more all-cause mortality, you see more cancer, more heart disease, more recurring infections in those who have taken rounds of antibiotics earlier in their life and then throughout their life. That seems to be clear. And they're more prone to mood disorders and those conditions as well. But first off, if you look at what's happening here, you see this different antibiotics for different conditions. However, antibiotics are frequently prescribed for this condition, and we're talking about acute sinusitis, twice as frequently in elderly people. Consequently, antibiotics usually have no effect on the course of the illness. Indeed, a recent Cochrane review found that between 89 and 95% of adults treated with antibiotics would be cured no faster than with placebo. This is something I see over and over and over again whenever I'm looking at different conditions in the outpatient setting, particularly. Furthermore, regular use of antibiotics to reduce exacerbations and complications is not uncommon in persons with chronic obstructive pulmonary disease, COPD. A variety of treatment regimens have been used for this condition, including continuous, intermittent, pulsed regimens. A 2018 Cochrane review of 14 studies found that prophylactic antibiotics reduced the frequency of exacerbations, with continuous antibiotics more effective than intermittent. However, there was no effect on hospitalizations, disease progression, or all-cause mortality. So let me rephrase that. So that means when they say it is more effective, they're talking about symptom suppression. They're talking about reduction in clinical symptomatology. But whenever they go to this however part, there was no effect on someone becoming hospitalized, okay? Becoming chronic, having another episode. No effect on disease progression. No effect on all-cause mortality, meaning no effect on if you were to die. So if I said to you that I had a drug or a supplement or a nutrient or a compound that I could give you that would lower your symptoms for a period of time, but it would not stop you from having recurrent episodes, flare-ups, it would not stop you from ending up in the hospital or the ER, and it would not extend your life in any way. That sounds to me like it's an ibuprofen. Okay, so it reduces symptoms for a period of time, but it has no impact on how disease progresses. Okay, so we're not getting at the root of the problem, which that is what it is. That's fine. If that is what you want to do, is to suppress your symptoms. Now, that's mild compared to what some of the other studies say, which actually indicate that it increases issues beyond the usage of antibiotics. So we're talking about prophylactic here. Here we are talking about prophylactic antibiotics used in a treatment of recurrent cellulitis. Okay, so this is like an infection. It's actually a gnarly infection. It looks quite scary. And prophylactic just means before you suspect you're going to have the infection. So before someone's showing signs and symptoms, right? A Cochrane review in 2017 concluded that antibiotic prophylaxis decreases the incidence of cellulitis by 56% and recurrent cellulitis by 69%. However, the protective effect did not last after the prophylaxis was withdrawn. So again, we see we're reducing symptoms for a period of time, and it makes perfect sense. If you understand why the body is teeming with microbial life to aid in your immune response, to aid as one of your first line defense, if you will, with the outside world, and that exchange with the outside world, microbial life lines all of your mucous membranes. communicates with your nervous system and actually creates nutrients for your body to use. And, you know, the interplay between these microbes and our cells is so extensive that we probably barely even understand what's happening. So when you look at that and you understand that if I suppress that microbial life that's doing all of those functions and engaging in all those functions with my body, it would make sense that whatever they're up to remediate, bioremediate waste and to cleanse and to decompose dead tissue or repair dead tissue or help and assist in that process, to consume dead tissue, to digest and, to detox out those issues, then you can understand that if you suppress that response, then you will have less symptoms. It's no different than if you take a Tylenol or an ibuprofen and you influence the inflammatory cascade, suppress that, then you will have a reduction in a headache. You will have a reduction in joint pain. You will have a reduction in pain because you have suppressed the heat, swelling, and redness at that site, or even systemically. So you'll feel better for a period of time. But as soon as that is withdrawn, you will feel the exact same and have no impact at minimum on your long-term outcomes. And in many cases, you will actually pay the price for doing that repeatedly over and over and over, because you're actually suppressing the healing responses. Now, moving on, I have received many comments and messages. And one of the things that people talk about, that I've had people talk about, is, the big bad pneumonia. People are very afraid of things progressing to pneumonia. Okay, perhaps rightly so. But this is a study done on broad spectrum antibiotics, which is, the most common form of antibiotics given to people for those who have an onset of pneumonia. So what happened is, about 2,000 adults with pneumonia admitted to 4 U.S. emergency rooms. They were given broad spectrum antibiotics. They looked at 30-day mortality, length of stay, cost, C. diff infection, and they did a statistical analysis on this. Now, they found that about 40% of patients who received broad spectrum antibiotics, they found that broad spectrum antibiotics was associated with increased mortality in both the unweighed multivariable model and the IPTW analysis. Broad spectrum antibiotic use by either analysis was also associated with longer hospital stay, greater cost, increased CDI. So their conclusion is essentially that broad spectrum antibiotics appear to be associated with increased mortality and other poor outcomes in community onset pneumonia. So we see time and time again, whenever, at least every time I look into this, that when people are prescribed particularly broad spectrum antibiotics, they do worse. They will do immediately worse, or they will do worse months later, or even sometimes a couple of years later. Here's another study about prophylactic use of antibiotics in prostate biopsies. And you can see these for different procedures and different conditions. And in this one, this is just another one I came across. And this was in about 800 patients who were referred for biopsy. And of course, anytime you do that, they always want you to do antibiotics. And they looked at different groups. And what they found is that rates of infections were not higher in patients not receiving antibiotic prophylaxis before their biopsy. Therefore, antibiotic prophylaxis might be omitted. Okay, and I see those types of suggestions again and again in these types of studies and reviews. This was done just this year. So there you have it. That's where I'm at. That's where I'm currently at with it. It appears to me that, in conclusion, that antibiotic usage in acute settings and in outpatient settings for the UTI, for the sinusitis, for a cold or bronchitis, for prophylactic reasons does not seem to be supported whatsoever, and in fact has higher risk than it does benefit. Take that what you will. I will always continue to dig deeper into this topic because it is absolutely fascinating to me. But one thing does seem to be very clear as well, which is these drugs suppress symptoms. They are not ever treating any kind of root issue or actual true issue that someone has. And so they should be used in that light. They should be used in that light, just like a Tylenol, and ibuprofen, just like a steroid. It is not a treatment for true cause. It is a treatment of symptom. It is a treatment of symptoms.